why use an Elos scan bodies, right? That's there's so many different scan bodies on the market. This is just our observations on intraoral scans that we get in from different um, from different dentists, and we have scan bodies used by every single system out there. We get the scan bodies in that, and sometimes it's difficult to um, to find out which scan bodies are which and how to identify them one from the other and everything else. And I'm sure every lab deals with that one way or another. What we have here is this an article from the Journal of Prosthodontic Dentistry, September 2018, and it's a systematic review of intraoral scan bodies and implant dentistry. And I really think it's an excellent article, so you can resource that article. But it's a great comparison of all the different types of scan bodies. And this is just a little snippet of scan bodies. There's even more scan bodies that are out there, but it's a great comparison of all the different scan bodies. And if you look at the top row of the top view of the scan bodies, you'll see with the Elos scan body where the arrow just showed up, how the screw hole is very small. So you're getting more of a scan body area in that spot. And if you look along the bottom, you'll see the everything that's the metallic color or the purple or the blue, like on the Elos. These interfaces are metal, whereas the other ones they're just part of the peak scan body. What we've noticed, and we had this just happen in Roadsart Dental Lab last week, a doctor was scanning for a particular implant system, and they were using their scan bodies, and I guess the interface to the implant has wore out a little bit. And what we're doing is when the doctor was tightening down the screw, he's just getting a slight creepage of the orientation of that scan body. And we did 2 cases with them, and both cases were exactly out, that exact little tweak. So we narrowed it down to the scan body. So he's just getting rid of that and reordering a scan body for that implant system. We would have recommended Elos, but Elos didn't have a scan body for that implant system yet. The identification numbers that you notice on the side on the panel, the IO3B-D, we recommend to all the doctors to put that in the message. When you do your intraoral scan, you have a little message box there before you send it off. Just put in the message what scan body you used, and that will help us as dental labs a lot more in lining up the scan bodies. Next slide, please. So using a scan body, most of you know this already, but I'll just talk about it. You scan the upper, scan the lower with the healing cap in place of the implant. Once you've scanned the upper and lower, and the reason why you do that is so that you can get the contact areas of the adjacent teeth. Once you unscrew the healing cap, make sure there's no bone growth over the implant, and where the scan body will be placed in. The scan body should be able to lock into place, and then you screw it down at 5 Newton centimeters, and then you scan the scan body. They have 2 drivers, and the only difference with the drivers is the neck of the screw handle. Elos has a specific driver for the Elos scan bodies, and that driver works with every single implant. Okay, next slide, please. So we get constantly asked cleaning and sterilization. Elos has done this excellent PDF, this booklet or PDF flyer, and we will be supplying you with that flyer, with that PDF, when we send you off information with the questions and answers. So once you've scanned it and you unscrew that from the patient's mouth, just drop it in tap water. And the reason for that is if there's any blood or saliva or anything on that scan body, you're putting it in a moist environment, it won't adhere to the scan body. And then after that, completely submerge it in the scan body in a mild cleaning solution for 5 minutes. Again, on the sterilization and cleaning guide, they go into more detail on that. And I'll just leave it for you guys to read that. Use a soft bristle brush and a syringe to flush out the screw area of the channel. And then rinse it again and then follow the packaging and sterilizing procedure.